Welcome to the Pulse Check podcast. We're your hosts. I'm Sarah.
And I'm Sammy. Grab your beverage of choice and let's get right into it. Alrighty, welcome back to this week's podcast episode. This week I am joined by the Kathy Kurtis. Welcome, Kathy. She has retired. Kathy, remind me when you retired from nursing.
2014.
Okay, and that was 2014, so that was after being a nurse for 50 years.
Yeah.
Remarkable. So let's jump all the way back to that from 2014 to 50 years from then. What originally inspired you to become a nurse?
I knew that God put me here to be a nurse when I was as little as 6 and 7 years old. That's what I thought about. And so as I grew older, I realized that I wasn't very smart. I really had struggled in school, and I just didn't know what I was going to do to get through nursing. And I joined the church when I was 12, and I had a little conference with God, and I told him, I said, I want to be a nurse, but you got to help me find a way to do this because I don't know how I'm going to do it. I just couldn't put things together. Mm-hmm. And he inspired me to make study cards.
Oh.
So every subject I took, whether it was math, I would put a question on the back was the answer. Question, answer. And I got through high school as a B average, and I got into, and when I went to take my nursing test, I funked it.
Okay.
And they said, you should probably think about being an aide. And I thought, no way, I haven't gone this far to be an aide. Mm-hmm. And so, believe it or not, a doctor that I was babysitting for had a neighbor on Green Lake who was going to let me into St. Paul Ramsey on a temporary basis on probation. If I didn't do well, I wouldn't continue, but if I did, and I ended up graduating 7th highest in my class.
Yes, Kathy.
So, but it was a lot. It was study cards constantly.
I'm sure.
People would come down and ask, can I do your test? Can I do your study cards? And so that's what got me through. And then when I got out of nursing, when I graduated and got out of nursing, I didn't think about the emergency room at all. And in Cambridge was an opening for mom and baby.
Yeah.
But when you went to Cambridge, you did mom and baby, and then they put the first CCU unit up in Cambridge. So it was 2 beds.
Oh, okay.
So then we could monitor and watch who was having a heart attack, what was going on. It was just fascinating to me. You could see every level of the heart and know what it was doing. It was just fascinating to me. And then at the other end of the hall, we had peds. And that was my first exposure to somebody who abused drugs.
Really?
We had a lady who was there for kidney stones. Back then, with the kidney stones, you were in the hospital. Mm-hmm. And she'd put her light on, and she'd be sweaty and just screaming for pain. So she would pass the kidney stone. All of a sudden, here came the kidney stone. Mm-hmm. And we would put it out at the desk, and we'd look at it, and we thought, oh, wow, because it was a bigger kidney stone than I've ever seen, because, they are usually little teeny crystals.
Right.
Well, then one day, this went on for months. And then one day, the patient next to her says, she sprinkles water all over herself before she calls you guys. Did you know that? And so we didn't have cameras then, but sure enough, she sprinkled water, and then she'd take the Thorazine we gave her, she'd melt it in her mouth, and that was her kidney stone.
Nuh-uh.
Yes.
And then you guys would not have caught on to that until that other patient said something.
Yeah.
Wow.
So then we called her on it, and she admitted it. She had to go into some kind of a rehab program.
Yeah.
I seen her on the street many times, and she'd always say hi to me, but
Really? Isn't that so interesting, too, when you see those patients on the street? Do you ever feel awkward?
No, not usually.
Okay.
But, that was my first exposure to somebody who needed drugs.
Yeah.
Was really kind of an eye-opener.
Oh, for sure. You're like, wow, people actually do this. Well, great. So, you've worked in mom and baby, the CCU, and then eventually the ED. Mm-hmm. What led you to eventually stay in the emergency department?
Because Cambridge got an emergency department.
Oh.
Because before, when you worked on the floor, if someone came into the emergency room, then you'd go down and take care of them,
Yeah, right.
But they finally got to the point where they got some funding for a small emergency room. It was 4 beds, and then a trauma room with 3 beds in it.
Wow.
And so, they put an ad up to say anybody want to work in the trauma room. And when you went down there the first couple times, there was no TNCC, there was no CCR, and there was nothing to give you a guideline as to what to do.
Right.
But you just learn. Doctors would come and they teach you, and you just learn. And then when the classes came up for the CCR and then the trauma classes, TNCC, then everything became standardized, and so you'd know what you'd have to do. And
Right.
and were there patients that died because they didn't get the right care in Cambridge? No, I don't think there was anybody.
Yeah.
I think there was enough doctors, enough people around. But for some reason, the big traumas, we didn't have the ambulances we have now that we could transfer people. So
Right.
a lot of people just didn't make it. They just didn't make it because they were too sick. They were too,
Yeah.
they were too broken to fix.
Right.
I remember one guy came in and he was hit by a train down in Isani, and they brought him into the hospital, and I thought, well, his lung was collapsed, so they had to put a chest tube in.
Shoot.
But we had no way to leave the chest tube in because we didn't have the sucking systems we have now.
Right.
So we had to take it out, and then every morning we had to go back in, put the chest tube in, drain out the lung.
Yeah.
That's 50 years ago, but he didn't make it because he got infection in his lungs. But now, then not too many years later, they got cooperation with other hospitals, and we could send patients out, and then more patients made it. But
Right. Well, I was going to ask you, like, how do you feel like nursing has changed from when you first started to all the way to like 2014 to even now?
I can't even
put a finger on it.
You start
Everything.
with sexual assault all the way up to just like trauma and what you do, and you call trauma codes and people come down and help you. I mean, there's so much more communication and so much more help from other areas that it's a different. And then just going from paper charting to computer charting, that was a huge change for all the nurses. But when a patient left, they got a nice set of instructions instead of some chicken scratching at the end of a piece of paper, So,
isn't that nice?
yeah. So that was a big change.
Yeah. Well, looking back from like the time from when you first started, what kept you in nursing for so long?
I loved it.
Okay.
I loved it. And the salary was decent. I got married and we moved to a different town, and I worked in that. They had a CCU, ICU, and then the ER all in one long hallway. And so I worked there until I had Amy. And then when I came back, I worked on the medical floor for a little bit, and then we moved over to Cambridge, and so then I started working at that point in different hospitals. So
Wow. Kathy, tell everyone how many kids you have.
I have 7 children.
Wow. Shout out to them. It's crazy. She's a hardworking woman having 7 kids. That's awesome. And so looking also back with the ED, so what skills do you feel like made someone successful in the emergency department?
You have to be able to stop and think on your feet. You can't walk out of a room knowing a person needs oxygen. You can't leave a room without putting an IV, and if you know that you need an IV, you have to be able to make those decisions. And if you feel what you're going to do, get somebody that knows what to do. You can't leave a patient needing something and you walk out. And if you feel you can't do it, you don't belong in the emergency room.
Okay.
You just don't.
Yeah.
So you have to be able to assess a patient, check their airway, check their breathing, all that stuff, and then you've got to make a decision what to do. You just can't be fearful. And there were girls that didn't do well in the ER.
Right.
Didn't do well. So,
Right.
yeah.
Well, with emergency room being such a high stress situation, how do you feel like you dealt with that mentally?
About once a month, we'd all get together and talk about patients.
Right.
Should have done this, you should have done that. What about that? And that helps. Talking about it afterwards helps. And they even have now stress relief conferences after, like if we have a trauma code or whatever, they'll have a stress relief. What could we have done different?
Good.
Why did we do this? So they have, when I left, they were having those all the time because they found that there were people that blamed themselves if something went wrong. And
Oh, shoot.
so we had to go back and make sure that people didn't. And even after I retired, I went back and I thought about, what if I would have done this wrong? What if I would have done this? And I actually had to talk myself out of this because I kept thinking back to 4 or 5 people that I felt I could have probably done things a little differently, And
Sure.
it's hard to get rid of all that. But when I work, I usually work charge, and so I had a lot of responsibility. And so there were a few people that I felt I could have been handled better. And Yeah, everybody has it. I don't care what you are.
Right.
You have things you wish you would have done
Yeah,
differently.
that you hold on to.
Yeah, and you don't get rid of them, you know?
No.
Yeah.
That's true. It just stays in your head. So with, again, emergency being intense, the emergency department, is there a moment that you can talk about that has like stuck with you for all these
my
years?
gosh.
I know. Probably hard to just choose one, huh? You've seen so many things.
Yeah, I have seen, I mean, there's been some that have been silly things, like we had a new girl working down in the ER, and the doctor was in the room, and he says, I need some ice stream. So ice cream, they wash eyes out with them.
Oh,
so
okay.
She goes down to the dining room and gets ice cream. Yeah. she brings back a cup of ice cream, and he says, what are you doing? He said, I need ice cream.
Yeah.
Oh, she felt so bad, but that was hilarious. We laughed about that for days.
That's
it was so funny.
so funny.
And, you know, there are things like one time a guy came in and was high on meth, and the police brought him in. Mm-hmm. And so we have medication to give him a shot in their arm so they could calm down. I can't remember the name of the medication right now, but anyway, he grabbed him, I grabbed him, somebody else grabbed his legs, we got him on the floor, and I had the shot in my hand, and I gave it to the policeman.
Oh my gosh.
I didn't inject it, but I gave him, he said, ow! And I said, oh, I'm so sorry. So I pulled it out, and the mistake I made was then giving it to the patient. She changed the needle. Oh.
Yeah, that is so funny. What did he just say?
No,
out?
he went.
He
he went and made an exposure record, which he wouldn't have had because the needle was sterile.
Exactly. You're like, you're fine.
Yeah, no, the patient should have made an exposure. Anyway, that was really hilarious.
Wow, that's intense. Wow. That's so funny. I can't even imagine doing that today. That's so funny. What was the most rewarding, I guess, part of working in the emergency department, would you say?
It's nice to treat them and treat them.
Okay.
So they come in and you see somebody, a little boy, the cut. We had a little girl one time that came in, she was blue.
Oh.
And if she'd cry, she'd pink up. And she was probably at 2. And then as soon as she'd go to sleep, she'd turn blue. And then if we stimulated her and she cried,
Oxygen problem.
Yeah, I mean,
yeah.
and yet we did
It's so interesting.
everything you can think of. We would oxygen on her, whatever. But as soon as she'd cry, she'd be nice and pink. So we kept her in the ER. We were going to transfer to children, and then Grandma come walking in. She said, "How is she doing?" And I said, "Well, what do you know about this?" She said, "Well, I found her chewing on my patch that she found in the garbage can."
Oh.
And it was like I don't think it was a blood pressure patch. I'm trying to think of what it was. But it was some kind of a patch that she would put on her skin every day. And so we had to then counteract that medication.
Yes.
And she finally did stay nice and pink. But boy, that was...
Good.
We admitted her for the night because we didn't know for sure how long it would last.
Exactly.
Yeah.
Yeah, keep an eye on her. Holy bucket.
So,
That's a lot.
And we had a hotel fire down in St. Paul one night. And I was new to the burn unit. I worked in the burn unit for a little bit in St. Paul. And at that time, we used activated charcoal to wrap everybody in activated charcoal dressings.
Yeah.
Because they wouldn't get infected. Mm-hmm. But everything was black then. Everything you wore was black. Everything they seen was black. So it was very depressing to work in.
Wow.
And they didn't always think of mental health back then. They didn't think that how is this environment affecting this patient. And
like they are now. Yeah.
And we worked with him for 6-7 months, wrapping these wounds and putting him in baths. We could take the wounds off, whatever. And they let him go home one weekend, and he got on the bridge and jumped.
Oh.
Yeah. You just didn't think about what was happening mentally to this patient.
Yeah, that's crazy. Well, because you're just trying to fix their body. You don't think about their mind.
But it showed me very early on how important it is to make an assessment about what is going on mentally with this patient, because in today's world, mental assessments are, it's
like everything now.
Like everything.
I remember doing it to my patients, and just also, I don't know, listening to them, just like listening about their life, making sure they feel heard and seen goes the longest way. I know we were trying to fix their bodies, but it's good to listen every once in a while. Okay, so going back. So you've been married for 59 years, raised 7 kids, working as a nurse. Amazing, Kathy. How do you feel like you balance that all?
You know, sometimes I think that there were some of my kids that took the scrap more than others, especially like my ones now that are in their 40s. When I started working in Cambridge, they were giving a lot of little sentences. And so that if, let's say that I worked full time, but somebody who worked part time could pick up days. So they never got little sentences, but full time people always got little sentences.
Right.
Well, 2 days a pay period off your check is a lot of money. And so, but they didn't care, they had to be even.
Yeah.
And so we got the Nursing Association to come in, but even with the Nursing Association, we still had to take our set number of. And at that point in our life, we just couldn't take that 2 days. So I went over to St. Cloud, and I thought, okay, I prayed about it, and I said, if there's an opening on my weekend off, I'll work Saturday and Sunday over in St. Cloud. And there was. So I started working 2 12-hour shifts over there. And I think a couple of my kids not being home every other weekend was hard on them. And it as far as bringing home my work, that wasn't the problem. It was not being there for 12 hours that I think hurt them. And sometimes you can't help it. It's just
You really can't control it.
I didn't work because I wanted to be away from my family. I didn't work because I thought I was more important to work. I worked because we actually needed the money. We had Amy on the mission, and Tony was in college, and we just we had to have the money.
Yeah, exactly.
So I do feel that some of the kids kind of took the brunt of that. But you do have, and if you are a person that needs to have a lot of time away or a lot of time to do things, and you have a family of 7, you're going to find that either you don't have the time or you're going to neglect your family. That's all there's to it. You just It takes a lot of organization, and it takes a lot of motivation to be a mom of 7 kids and then work. It does. I'm not going to fool you.
Right. No, I'm sure.
It takes a lot.
Yeah, because you worked nights, right?
Yeah.
Okay, gotcha.
So I could get home and I could get them on the bus, and then I would sleep until the bus came at 2, and then I would get up.
And then, oh my goodness.
Yeah.
So lots of sleep deprivation.
Yeah.
For sure. Do you feel like that played a huge role on your mental health personally?
It was funny. Even now, when I could sleep 12 hours, I only sleep about 6 or 7. I just...
Still today? Really?
Yeah.
Wow.
Yeah.
Okay.
And working nights all those years,
Yeah.
I've really thrown out my circadian rhythm because I have a real hard time sleeping at nights. I know it.
That's so hard.
I know.
Oh, you're making me feel like I need to switch to days right now because I'm working nights currently. So
Yeah.
I need to switch
For
it up.
how many years?
Well, this is my first year working nights.
Oh.
So we'll see. I would like to just switch to days. Probably it would be better
Well,
for me.
there's
But
two ways to look at that. Nights, you are your own thinker, and you are your own.
exactly, that's what
And
I love
don't-
about it.
And I don't like authority around all the time, looking at what you're doing. And so it depends on what kind of person you are.
I know.
I work better on nights. I work better working nights. And
I love doing my own thing and just being able to just do it, which is the best. But we'll see what happens when the years come. Okay, so what roles? I'm sure you probably had. Do you feel like you had a support system during that time with your family?
oh yeah,
You felt supported?
I didn't work full time until Tony went on his mission. So that was 1988. That I actually, otherwise I just worked every Tuesday and every other weekend. It wasn't until Tony went on his mission and then Amy was in college that we made the assessment that we needed to do something different. And so then from then out, then I went on nights at that time. I went on nights and
do you feel like they understand now, why you had to go to work? Like they have a whole other viewpoint of it?
And it happened to be at that time, all these big, Frank had an oil business and gas stations, and all these big gas stations came in, and they just swamped out everybody that was little, and so it was real hard. The natural gas came in, so people were just switching their furnaces over to natural gas and not oil.
Right.
So he had to take a real hard look at what he was doing. And his brother left, and so we were on our own with the business, and I did his book work. I just said, Frank, we're not making it.
Yeah.
We're not making it. And about that time, he had to have his aortic valve replaced.
Oh, shoot.
Yeah, I know.
Okay,
So
that's like a big surgery.
So we had so much going on. And after that, then I just said, you just got to think about this again. And so he was out of work for about a year. And so that's when I went over to St. Cloud. And so it's just kind of a necessity thing that I had to do it, And the kids understood, and Dad was home. But I don't know.
Yeah.
You never know what's going to come your way in life, and you know you're not going to get through without some tests. There's no
Right.
way.
Right.
You know, you're all going to have tests, and that's
Yeah.
all there is to it.
What do you feel like your family life looked like? Like you just went to work, took care of the kids, then went back to work, or were you guys able to plan any?
Every morning I got up, I washed the loads of clothes,
Yeah.
and we had a big swimming pool in our backyard. It was a 28-foot round. The kids enjoying themselves back there. They had a four-wheeler that they raced around when they all had bikes. We got a car for them when they could drive, and so were they neglected? No, they were not neglected. You know, and they each got jobs when they could get jobs, and I think they were happy kids. Our house was a happy house.
Good.
You know, I don't feel like me working or money crisis. You know, when they get all sitting around together, do you remember mom would do this? Remember mom would do that?
Yeah.
You know, all kids do that, but I think in the end they appreciated how we went about raising our kids. You know, they appreciate that we never gave up. We always had a vacation. We always had a cabin to go to. They had things at home to do, and I don't feel that my working made them neglectful at all.
Right. Good.
And in today's world, you need to see your mom work because there's very few moms that can stay home.
Oh yeah. Oh, for sure.
Yeah.
Yeah. You don't really see a stay-at-home mom anymore, and if they are, you're like, good for you. Congratulations.
You don't get to see it very often. That's for sure.
No, but I totally agree with you. I do feel like, as I would say, even with my own mom, like as I've gotten older, I've started to notice a sense of like empathy and gratitude because she was a full-time working mom. Like she was taking care of 4 kids. Can't even imagine 7 kids, but but it's a lot, and I know that they did like the best they could. So I think you get a sense of, like I said, gratitude and empathy as you start adulting yourself. Okay, so what advice would you give a new nurse, let's say like me, what advice would you give me as an example, just starting out, especially in high stress areas like the ED?
I fell into the ED because I loved it, but I would not limit yourself not trying other areas.
Right.
For example, I know that hospice is a wonderful place to work. I understand that people that go to PAR, they never leave. They love it.
Okay.
But I do think that you need to not get yourself so narrow-minded that you don't try something else.
Okay.
Because there's lots to learn. There's lots to learn in every field of nursing. Before you were a nurse, that you just did everything. But now there's specifics. You got to start thinking about what area do I really like.
Right.
You know, and rewards are important. If you don't like continual patient care, then don't get into floor nursing. In floor nursing right now, I hate to say it, but it's gotten to be a med passing charting, and that's all they do.
I will have to agree with that. Yes.
They don't do any nursing.
Right. It's hard. It's hard to,
Yeah.
for sure. Like I know for me personally, I do obviously a head to toe assessment, try to take care of the patient. And then around that time, when the meds come, you got to get all their medications to them, and you only have so much time to do
And
that.
you got to get that charting right because otherwise the insurance companies will not pay.
Exactly.
So it's a game of money. And I don't care what anybody says. Nursing right now is not one with back rubs and how are you doing and what's going on at home. No. It's way past.
It's hard. It's
too
really
bad.
hard
It's too
to
bad it's not like
really form a connection with the patient for sure, because you're in and out of there. And with how many patients you have at a time, you're just trying to get through the night, I guess, through your shift.
No, it's too bad, but I've been in the hospital a couple of times and I thought, oh my gosh, I slept in my own clothes the first whole night. Nobody even came in and asked if I wanted a gown.
Exactly.
Never brought me a toothbrush or toothpaste. And have you taken a shower or nothing?
Right. You're like, I'm so sorry. You just feel terrible. You feel so bad.
I was very disappointed with nursing as such up on the floors. And I was at both 2 different hospitals. And I thought, I can't believe this. I just can't believe it. But
Right.
if you talk to nurses who work, they'll tell you, no, our job now is not taking care of patients. It's charting and medications.
Right. Well, with that then, with you saying that we need to keep a broad eye, do you feel like you missed out on any opportunities? Like you wanted to try out any areas of nursing that you never got to? Or if like emergency wasn't even an option. What
Well,
do you feel like?
I did floor nursing for a while when I was at a different hospital.
Okay.
And I did moms and babies, and that is 75% boredom and 5% panic. I mean, it's you either like it or you don't, and they come in, they're gone in 24 hours. You know?
Right.
I don't know. Wasn't my thing. Moms and babies wasn't my thing at all.
Why do you feel like that wasn't your thing?
It just was. They'd come in, and the moms were in pain and wanted to be relieved, and blah blah blah. You know, and the next thing you know, they had their baby, and
Yeah,
then the
you're
next
like, well,
day they
you're
were
gonna
gone.
hurt. Yeah.
You never. If did their milk come in, or are they depressed, or what? You just they're gone.
Yeah.
Insurance companies will only cover 2 days. It gets
Which is
back
so
to
unfortunate.
Insurance company.
Seriously.
And I think CCU would have been fun to stay in, you know, because of what you can see there. But in the ER, you see the same thing. They come in, you put that lead on, and you see elevated ST stations. You got to do something, man. You can't just sit there looking at them. You know?
No.
So,
No.
I don't know. We had, in fact, one girl come in one night in labor, and she made it in the ambulance to the ER. And I don't know why they just didn't take her upstairs, but she had the baby in the ER. And I said, "Oh, you've got a beautiful girl."
Yeah.
She says, "Yeah, but I got another one on the way. I got twins."
What? The panic I would have felt.
So we got her upstairs for the second one to be born. Oh my God.
Yeah. That must have been so crazy.
Yeah.
You really got to think on your feet, though, in those
Yeah.
moments. You're like, hey, we got to get you up there.
And we had a 17-year-old that came in, pain. And she said, "I think I'm having a kidney stone. I'm having so much pain. I don't know what's going on." And so I said, "What was your last period?" They've kind of been uneven. And I said, "What do you mean?" "Well, I haven't really had one for a couple months." And I could feel her stomach that she definitely was pregnant.
Yeah.
And so I said, "I'm going to do a vaginal check." And here she was dilated to 7. I said, "You're going to have a baby." She says, "What?"
What did you do, Kathy?
Well, I called the doctor. He said, "Oh, she is not." I said, "Go check her.
Yeah.
Go check her."
Right.
She said she's dilated to 7. Yeah, I know.
Yeah. Do you feel like your expertise in the mom and baby like helps with those things?
Oh yes.
Yeah.
None of the other nurses would have gone and done a vag check. No.
That is so interesting.
Oh.
What do you think personally? What do you think truly makes a great nurse, especially in today's time?
I don't think you can think mechanically about charting. At some point, the only way you're going to stay in nursing, you've got to get involved with people. You're not going to like it.
Right.
There's no way you're going to enjoy nursing by sitting behind a desk and charting. No way.
Oh heck no, no.
Oh, that isn't what nursing's about. But
It's too boring. That's boring. That's the most boring part of the job is the charting. But I mean, obviously, it needs to get done. However,
I know what.
I think for me, the patient interaction and all the funny stories that I've gotten from those patient interactions, like helps me stay in it for sure.
Yeah.
If you could go back and tell yourself one thing at the beginning of your career, what do you think that would be? Oh.
One thing that I would tell myself at the beginning of my career: love it or get out.
Okay.
You gotta love it or get out.
Yeah.
You can't go to work with a crabby feeling about people being sick, or you will not like nursing.
Right.
Especially in the ER.
Yeah.
You see migraine headaches over and over again, or you see people coming in for this, "Oh, my back pain," you know, knowing they're just getting drugs. And so you either gotta love it or get out.
I agree.
You can't stand it.
It's one of those things that you need a passion for. Otherwise, I feel like then if
But
you don't have
nurses that don't have it.
exactly, that's what I'm saying. Like if you don't have a passion for it and you just look burnt out and you treat your patients terribly because of it. Like I've noticed a lot of nurses that they need to get out. It's their time to get out just because.
And they're not nice to people they work with.
Exactly.
They're not fun to work with. And so I don't know. That's the only thing I can say is you gotta like it or get out.
Is there something, looking back on your career, is there something that you feel like you're most proud of?
I actually set up one of the first sexual assault kits for Sandy County.
Really?
Yeah, the sexual assault kits, they realized how desperately we needed this. This is quite a few years ago, you know. But the tests weren't consistent, you know. And so they actually started in St. Cloud, and I was working there at the time. And so when I went to that class, I thought, I'm going to do that for our Sandy County. So I went back to our Sandy County, and I told the doctors about it. And I went to the actual courthouse, and they were setting up a sexual assault abuse committee. So I got on that, and then we started doing kits, standardized kits. And I got voted the
amazing.
Nurse of the Year for doing that.
Yeah, you did, Kathy.
So, yeah. So, but you know,
That's
the
so
sad
awesome.
thing about that is that
Yeah.
even though we did all the sexual assaults right, the state was so slow
Mm-hmm.
in getting them taken care of. They sat down there, and I'm sorry, but for some reason in our society, for years it was
Yeah.
okay to sexually assault a person. You know?
Ugh.
But thank goodness
Makes
that's
me throw up. It's
changing.
terrible.
It's changing. But
Yeah.
when I started all this, there's many people who would say they'd been sexually assaulted. You know.
Yeah.
And but I seen it change, and I was excited to see it change.
Which
make a
is
difference.
amazing.
Yeah.
That's so good. So it sounds like, for one, you've worked with many, many patients, and you've worked with some amazing coworkers for sure.
Yes, I
My
have.
mom being one of them, which she loves you, so that's awesome. But how do you want those patients, like, let's say, like you said, you take care of them, they leave, or even the coworkers that you left when retiring, like, how do you hope that they remember you?
I meet them on the streets. I did and I don't anymore because it's been too long. But I can't tell you the grocery store. You were the nurse that took care of me. Remember?
Yeah.
You know,
Aw,
so
yeah.
when they're coming sick and they're desperate, they remember people that have been kind to them and nice to them. Or the little boy was really sick and you got him better. And I remember one girl had a uterus that was coming out, and so I had to keep my hand in the uterus, pushing it up until until the doctor got there. Yeah.
Yeah.
She was
Holy
had a
buckets.
prolapsed uterus, and you don't live through prolapsed uteruses.
No.
So-
Well, that's actually crazy because I normally hear that you shouldn't like go in and check with a prolapsed uterus. Like you shouldn't be even touching it. So that's amazing that you did that.
Yeah, I had a glove on, and I just kept it up until the doctor got there, and they took her into the OR. And I don't remember what happened to her, but I do know that. And then there was a lady that came in one time. Her husband had a stroke, and she was at home taking care of him. She was probably in her 60s, maybe a little older.
Oh, okay.
And I noticed that her shirt was all wet in the front. And I thought, what the heck? I thought maybe she had turned him or something and got wet.
Sure.
I said, you know what? I'll get you one of our tops so you don't have to wear that wet top. She said, well, it won't make much of a difference. I said, well, here, let's make you feel more comfortable. When I took that shirt off, she had 2 big tumors that were draining. Yeah.
Tumors?
2 big tumors on her breast, and she was dead in about 2 weeks.
Oh my god.
That's something here. She was taking care of her husband so dutifully that she didn't even take care of herself.
My heart.
I know.
That literally breaks my heart so much.
Yeah.
That's so sad. But I mean, even a dry shirt though, during a time like that, probably went a long way for her. So that's amazing. Wow, great job, Kathy. That's awesome. So now, what do you feel like nursing means to you that you've been retired for, over a decade now?
Yeah.
Yeah.
I miss it. I missed it for the first couple of years. It was really hard. It was really hard not to have somebody need you. You know what I mean? It was really hard not to have friends around. And we served a mission during that time, so that helped to go on a mission. But yeah, it was hard to give up nursing. It really was hard. And I kept my license active for about 2 years, but there's no sense keeping it active because
You're not going back.
it's too expensive.
Yeah.
At 70 years old, I'm not going back. So
No, that makes sense. How do you feel like do you feel like you've filled that cup in any way?
yes, I do. I feel like I was born to be a nurse. I worked hard at it, and I felt that I felt proud of what I did in nursing.
Good.
I didn't feel like
Amazing.
yeah.
Do you feel like you have hobbies and stuff now that are filling that, I guess, sense of being needed
Yeah.
or sense what have
Since
you
I've
been
home
doing?
from my mission, I babysat.
Yeah. You have kids all over again.
I babysat every day almost. Yeah.
Yeah, which fun. But do you feel like you're able to do things that you enjoy yourself as well?
That's an interesting question, Sammy, because I was thinking the other day, what is joy? I mean, joy certainly is our love of our Savior. I know that. But if I could go do anything today, what would I go do?
What would you do?
What would I do?
Exactly.
Sammy, what would I do?
You have no idea?
I'm going to go home and plant my garden. Isn't
And
that joyful?
that's
And-
in a 90-degree day.
But it is funny how you get so situated around fixing people and fixing your family, and all of a sudden when you've got all this time, what do you do?
Exactly.
I don't know.
But it sounds like you got to figure that out.
Yeah, no,
Which
I know.
will be good. I do remember, like, when you first retired, your phone calls even with my mom about you being like, I can't do this. I just need to go back.
I know it.
You're rethinking it all the time.
Yeah.
But, I mean, you have done a lot of volunteer work.
Oh,
I know
yeah,
that.
I volunteer every Thursday at Shalom. Mm-hmm. And Frank is involved in that little cafe in town, and he delivers meals, so I help him with that. But I do think you have to think all the time, what would you do? And we've never been big travelers, we just,
Okay.
it just isn't a...
I was going to ask if you're going to travel.
Yeah. I don't know. It's just that between my food choices and my colitis, I can't just go anywhere and eat because it just upsets my stomach. I
Right.
can't eat any meat, and there's just things I can't eat, Mm-hmm. And I don't know. I just don't know. I mean, that is something that bothers me, that I can't find something to kind of fill in the blanks.
Right.
And at 80, I'll be 82 next month. I think, well...
You look great, girl.
Do you need to fill in the blanks? I don't know, Sammy. I don't know.
Yeah.
I don't know.
But that's okay. Well, it sounds like you're going to have a whole nother journey coming up for you of figuring out what you're going to do.
Yeah.
Which, I mean...
Do we sell our house? Do we keep our house? I mean, it's a huge house. Alicia will move out now because we've had 11 people living there for the...
Wow.
Alicia moved in last October with her family because James went to Utah.
Okay.
And so Alicia's been downstairs, and Amanda's been, of course, in the wing where she is. And so our 55 square foot house has been every corner. And if you bring it home, if you can't eat it, or it doesn't get thrown away, don't bring it home. That's
Right.
the rule.
Yeah.
Because it's just, there is no room for anything. And now, of course, Sydney's decided she wants to have her graduation party at my house.
Oh, God. Yeah. Well, Kathy, it sounds like you're taking care of everyone else, but I think it's important to remember to take care of yourself too.
I know, that's a great idea,
Yep,
Sandy.
I know. And do things that you love. It's so important,
Yeah.
which is good. Well, Kathy, I guess that'll be my last question for you. You're great on a mic, so thank you so much for being on the podcast this week. But then I'll talk to you guys next week.